question of what have been your experiences with the toolkit so far for you and for your organisation?
It was a really positive one, both in terms of solidifying our understanding, our learning as part of cascading, but it's the discussion and the conversation piece that then started almost like as a kind of catalyst that has been the most useful part of that. And we're
absolutely, the science of the climate crisis doesn't change regardless of whether you're in catering or transport or anything else. The impacts on your hospital or your service delivery doesn't change. You know, if it's going to flood, it's going to flood. But actually having it so that the procurement department understands what it means to procurement. That for me is one of the beauties of the carbon literacy healthcare training toolkit, that actually you get 6 modules that are the same, but you then can adapt 1 or 2 of them depending on the department.
You need to start understanding impact, the scale of it, and doing that quantification or becoming carbon literate and understanding the scale of the problem from a health perspective and being consistent across health really gets everyone on the same page. And I think you can't underestimate that.
One of the things that I particularly have enjoyed from the carbon literacy training is that delivery from a respected person from within that team. And that to me, I think has been crucial. So actually being able to sort of cascade that training so that you've got other trainers in other departments and on other wards, be that respected person who knows what the material is, and to then deliver that to their work colleagues has been a real boom from this as well. Actually, one of the beauties that I like about the slide set that the Carbon Literacy Project have is that there are specific slides in there that are tailor-made or that are tailorable and customizable to your organisation and to your location. So this is about, you know, the staff who are trying to get to work, or it's about their families, it's about your family, it's about your patients. And to me, that really brings home the message to it's us and it's here and it's now. It's not in 2050 and somewhere overseas.
Yeah. Going through the action plan and then thinking, oh, actually, this is something that I can do, or hearing other colleagues come forward with their actions, very much a realization of, oh, this is something that I can participate in, and this is how I can communicate to some of those targets that have been set. You know, the delivery of the green plan typically sits within a sustainability team, or a smaller team that's coordinating that activity. So for some learners that we've had on the training that might not have had a lot of direct engagement with the sustainability manager or sustainability team, is that opportunity to get involved. And a lot of staff, when they get invited to a carbon literacy session, may not have heard of the standard before. So it's about this being something that's substantive and that the organisation supports, not one of the many things that might be perceived as peripheral, which sometimes fall into people's inboxes.
And it's about how can you spread that the great examples of great practice far and wide. And that to me is one of the things that the Carbon Literacy Project can do as well. And any advice or tips to sort of NHS trusts or healthcare organisations who are looking to deliver this? So
you've got to think about how who are the key individuals that can, you've got to kind of think one step ahead of yourself a little here and think about who are the key individuals that can go forth and make the most impact once we've delivered the training session.
The carbon literacy training is a great bedrock, it's a great foundation, but it is also about, well, what happens in 3 weeks, 3 months, 12 months down the line.
We're quite keen to have a model where perhaps those that have delivered it a few times kind of shadow and support that cascade, because I think there's something about how that solidifies your own ability to deliver the session. But I think it also takes away the pressure for people who have perhaps just been on the training and then suddenly find themselves in the kind of teaching seat.
How do we roll this out more widely? How do we get that 1.3 million NHS staff?
I think we've got everything we need. We just need to, as I say, shout loud about the work, make some really good networks. I think the spread and adoption will come with that.
I think the thing that will actually unify people and get people motivated is creating the vision that says, when we've got there, this is what it will look and feel and sound like to work in the NHS. And that visionary piece is the bit that you know, we're trying to work on, because I think it's easier for people to go over a mountain, and let's face it, it is a mountain, if they know what it looks like on the other side.
I think the toolkits provide that great opportunity. You know, there's ready-made materials there which do allow you to jump feet first in. I think that's one of the great things about carbon literacy. Training the trainer is going to be ever more important, and you know, a lot of the training that we deliver as a consultancy, we're offering that, and then we're following that up with the support of, and then we can facilitate at subsequent sessions afterwards, but putting the emphasis on those individuals going forward, you know, and understanding sustainability. Sustainability is a societal challenge. It requires a societal response. And we need to get carbon literate individuals to realize that they can go and do the training themselves. This is not something that is reliant on the sustainability department or, you know, an environmental or sustainable consultant to come in and do for us.
Just imagine if this is the first domino of all of the, you know, acute trusts or foundation trusts or ICSs, that suddenly we've got carbon literate organisations up and down the country. So Martin Luther King said, "I have a dream." He did not say, "I have a nightmare." It was all about that aspirational piece of where could we achieve, how could we get environmental or social justice. And so I absolutely think that we need to paint that I had a dream picture for our trusts or our organisations.